Hello, Feminine Roadmappers. Welcome back to Feminine Roadmap Podcast, the podcast that helps you navigate the challenges and the changes of midlife and empowers you to live a more vibrant second half. If you're finding us today on YouTube, please don't forget to subscribe and ring that bell so you don't miss any more of these amazing conversations. If you happen to be on a platform for a podcast, go ahead and subscribe, rate, and share. Today's conversation is going to be literally life-changing. My guest today is Dr. Salome Masghati. She is a board-certified gynecologist, and she's going to be talking to us about the integrity of functional medicine and how in functional medicine they look at all of the systems of the body to help us come to holistic health. Dr. Salome, thank you for being with me today.
Thank you for having me.
I'm really excited to talk to you. Now, I have spoken to the CEO and the co-founder of the company that you work for, which is Moment Health. And so I'm familiar with the company you work with, but I am interested to learn more about you and what led you in this direction.
Yes, I'm super excited to be with Moment Health. Just to tell you a little bit about them, I mean, the CEO and founder, Miss Alana, is just the most vibrant, incredibly enthusiastic person and very knowledgeable. And her mother is a pioneer in integrative and functional oncology. So she has a lot of experience through her mother in treating patients, and that includes patients with hormonal issues. Since, you know, in their cancer clinic, they have a lot of cancer patients, breast cancer patients, uterine cancer. Hormones have a big role in those cancers. So she has always been interested in hormones. And I found her for a common friend, and I'm super excited to be part of this company because, you know, their products are exquisite, high quality. And so I really align with their values. Myself, I went through the traditional path of allopathic medicine. I did my medical school in the University of Vienna in Austria, in Europe. And I came to the US for residency. I did a few years of research at UCLA, and then I got into OBGYN residency. Now, OBGYN residency is very, very rigid, very stringent. We have very long hours. We have a really, really strict training, and we learn a lot about obstetrics and gynecology, but we don't learn a lot about how to prevent chronic disease or how to take care of people who have problems beyond emergencies. So while I had a fantastic training, which I'm really grateful for, there was a lot that was left unanswered for me. I further did fellowship training to get more specialized in treating women with pelvic pain. That was something I was really passionate about because that's, again, a niche where women get overlooked. And I was basically trained as a surgeon for pelvic pain patients. That included fibroids, endometriosis, women with adenomyosis. So kind of, you know, these diseases that are not cancerous, but they're also severe enough that can really impact a woman's life. And again, very grateful for the training I received, very happy to be able to help women surgically. But I was left with this void after surgeries where women had a lot of questions for me, where they wanted to know what had led to the disease to begin with, and how they could prevent it from coming back, and how they could prevent having another surgery that they might need. And so I just had to dig deeper and find out more answers. And that led me to the path to functional medicine. I was very lucky. One of the reps that come to the hospital to introduce surgical instruments to you, we really, really connected. And she was telling me about this conference on anti-aging and functional medicine. And it was the A4M conference. And she invited me to go with her. And through there, I mean, that was the beginning. I mean, I met so many like-minded physicians, and I learned so much about the possibilities of training beyond my traditional allopathic training. That's how I got started, and that was 3 years ago.
Oh, wow. You know, for a lot of people, functional medicine is a foreign language. Really, we are in America and possibly in other westernized countries, we have a system for everything, which is fantastic. But every once in a while, like you said, there's these gaps, there's these areas of opportunity where there's information missing, right? And I want you to kind of explain, what is functional medicine? How does it work? Is it the same as or different than integrative medicine? Just kind of like a rudimentary, like, what does that mean if someone's hearing this for the first time?
Yes, absolutely. I do think that we're dealing with a lot of new terms here. There's not tons of regulations for those, yeah, honestly, definitions that we are using. It's a really broad term, functional medicine, for physicians and it's honestly not just MDs, but there's multiple types of providers or professionals that come to provide this care. It can include nurse practitioners, physician assistants, naturopathic doctors. It's chiropractors, health coaches. Mm-hmm. It's more about a philosophy of it's about a philosophy of looking at the body as a whole, looking at body systems, and not just focusing on symptoms, but looking at how different body systems could be connected with each other. So whether you call this functional medicine or you call it natural medicine or naturopathic, I think these are just definitions, but at the core, it comes down to what is your philosophy and your approach to health and disease. And so my philosophy is, I am absolutely grateful for the background and the steadfast background in allopathic medicine that I have, because it allows me to recognize severe conditions that need to be treated in an emergent way, like if someone needed surgery, if someone had cancer. But at the same time, I am now capable of providing them with lots of information and education on what they can do in addition to that, or even in place of that. So, nutrition, lifestyle, how can I help them improve their sleep, their environment, and their hormonal health, for example. For women, I mean, hormones are such a big part of their body. So that's what I would say. And then when you come to the definition of integrative, I think integrative or complementary medicine means you're kind of open to bringing different modalities of care. So, for example, you include chiropractic care, acupunctures, homeopathy, herbal medicine. So these are just definitions, but you can be a functional medicine doctor and still believe in integrative medicine. Do you see what I'm saying? And I often use all kinds of modalities for my patients. So when I take care of someone, doesn't mean that I'm the sole provider. I actually often refer them out to other professionals that could help them with other modalities that I don't offer. It's really important to me that I give the best care, whatever is needed. And sometimes that means, you refer out or you include a whole team of people that help you take care of a patient.
And for me, this is the thing that I find so attractive about functional medicine. That is that I'm a whole body, right? And so if we only look at my shoulder, this is connected to my trapezius muscle, and it's connected down to my elbow, and it goes down through my chest. Like there's this network of muscles, this network of tendons, this network of nerve endings, right? All of these things are all connected to each other. And it just didn't seem logical to me to be like, what's happening here? And not thinking about, is it a radiant pain? Like, is it because of something else? So it's like, it's a bit Sherlock Holmesy to me, you have to investigate and be more holistic in the approach to the body. Am I correct?
Yes, you're absolutely correct. And I think that's why you can replace a good physician with AI, because you don't want to just Google something and put algorithms together. You want someone who can actually connect the dots for you. But that takes someone who understands the body as a whole and has lots of experience. And I'm the first to say, I'm still learning. I'm still learning with every patient case. Teaches me something. It's really not until you apply things that you connect and learn from patients and they learn from you. So yeah, I agree with you. It's about the connection. I'll give you an example. I said I got into functional medicine later on, but to be honest, the first encounter I already had with some sort of how the body's connected was before I even started residency, when I was doing research for pelvic pain at UCLA under Dr. Andrea Rapkin. And we had this pelvic pain specialist come in. She was examining women's pelvic musculature, and the way she examined it, I'd never seen a gynecologist do that. I learned so much just from watching her and from that one day with her, and I've been using that exam ever since. But she was telling us that when the pelvic muscles are very tense in the pelvic area for a woman, there's often an association with the frontal lobe in the brain. And that can be associated, to previous trauma, but it can also be associated, with neurotransmitter problems. So if someone is lacking, dopamine or, just things that the way she put it together. And then beyond that, she also taught us that in women that have pelvic pain, and a big proportion of those are endometriosis patients, there's an association between IBS, interstitial cystitis, and endometriosis. And she explained that through the neuronal pathways that go through in a circuit to the spine, up to the head, and then they come back. And she was explaining that if you don't address pain the right way, that includes multiple modalities, including, for example, behavior therapy, CBD therapy, and physical therapy, you don't access those pathways optimally. And so I just learned so much just from that. But again, it wasn't until much later then I learned even beyond that how much nutrition affects us, how much our light environment affects us, how much toxins in our environment affect us. So yeah, I mean, every single thing that I've done in my career, every single endeavor has taught me something, and I'm bringing all these experiences together. So I can't even pinpoint it to one single thing, but it's just really the multitude of things. And that's why I believe that when a physician is more experienced, the older they get, if they're open to learning, the better they become, because they have, in addition to knowledge, they have the wisdom to recognize patterns that they have seen before. And that's something that I'm obviously still working on, because I'm still relatively early in my career, but I am absolutely motivated to learn more. And I will be an eternal student, that's for sure. I never will assume that I know everything about the body. I'm still learning, and I love that about this career. That's, I think, what keeps me motivated for the patients.
I always think about the human body. It's like its own universe. There's the astronomers that look at the sky, right? And all the different universes that are out there, and the star clusters and all of these things. I feel like that's the human body. This is one whole universe with all these different systems and things. And so I would love to ask you a quick question about mindset, the way a person thinks, because the brain and the way that we utilize our brain, I feel, is very foundational to almost everything in our life, our successes, our failures, our struggles. Can you speak a little bit about how the brain and our thought life kind of comes into our health?
I'm so glad you're bringing this up. I keep telling my patients that I can give them the best supplements, the best lifestyle tips and nutritional tips. But if they do not work on their mindset, healing is going to be difficult. Now, it's not that everybody voluntarily doesn't want to improve their mindset, is that there is often stored trauma, and that we store that in our tissue, in our body, in a physical way, and we also store it in our mind. And so that trauma work has to happen as well. And I like to do this for my patients, where I bring this up, I address it, and gently introduce that into the conversation, depending on the severity of the case. But you're absolutely right. Your mindset can make or break the deal here. I have patients who were told they were at the end stages of a certain type of cancer, and they had the mindset that they had to survive because they wanted their grandchildren, see them grow up. And they survived 5 years beyond what was ever anticipated for them. I know patients that were diagnosed with autoimmune diseases or, other chronic conditions where they were told they would have a certain quality of life, and they didn't accept that diagnosis. And as they healed their body, they also used that diagnosis as a wake-up call to change things, other ways to look at life. And they used it in a positive way. And that mindset contributed significantly in their healing process. So what I'm really saying is, I don't believe anybody can heal if they cannot have a positive outlook on that healing is possible. And that's really, really an important factor. And to be honest, I do some of that work with my patients, but I'm not a licensed therapist. So if there is trauma work that goes deeper, I always bring that into the work as well, into the team, and so I include that, or I refer patients out to someone who can help them with that as well. Yeah.
You mentioned the word team, which I think is really profound because, people talk about doctors and I don't, this is just a comment that I've heard, that they have like a God complex. You have this one doctor and it's like everything he says is right. And he's the only one who has a say about your body. And I think the thing that I love about functional medicine is that I'm now a partner in my own health and body. Like you said, there's a team. So here's someone who's primarily over your care, but holistically looking at all of the pieces of the puzzle that is your health. And you get to have a say and a conversation. And it takes a little longer, which I like. The conversation, the questions that you ask of a patient are very different than I take my mom to the doctor. I'm her primary medical person. So, and I did that for my mother-in-law until she passed away. And it's like, I understand how frustrating it is to go to a doctor and have questions and get really lame answers. Please forgive me. I know I'm not a doctor, or no answers, or a prescription. To not be able to get to a simple answer frustrated me. And I've had several years of this now. And because I'm aware of functional medicine, and no doctor is perfect, right? I understand this. I'm not perfect, but I think there are better ways for us to manage and navigate our bodies and our health so that, to your point, we can heal. And I think that's the difference between most traditional, what do you call it, allopathic medicine. We are managing health, or I won't go political. So there's a different way that the world is going with allopathic medicine. When you get to functional medicine, we aren't bandaging. We're trying to get to the core of it, right? And we're trying to lift that up and deal with it so that it's not there, right? We're not trying, it's not the symptom, it's the cause. Am I right?
Correct. Yes, okay. You're so right. Often they talk about the root cause. I'm not sure how much I like that term because it's being overused, but it really is about understanding the reason for why something happened. And it's never one thing, right? I think we're all a barrel, and if that fills with a combination of psychological trauma, childhood experiences, whatever you were exposed to through your childhood, nutritional wise, and then as your adulthood comes on, as a woman, for example, going through childbirth, the nutritional, demands on your body with that, the stress that comes with it, the stress of being a young mother, then, the professional demands that you have, the stress, the environmental toxins you're exposed to, and it adds up and it adds up. And then things happen. And then there's one day where everything just, flows over. So it wasn't the one thing, but it's about a multitude of things that come together. And I agree with you that we have to look into why. Nobody ever looks into the why. When I was in the allopathic setting, medicine setting, I never had the time. I had 10 to 15 minutes, maybe 20 minutes for a patient consultation. Half of that time I had to be documenting and typing things up, and spend on, maybe 2 minutes doing a physical exam that was very limited. I never looked at a patient's tongue or their fingernails or their skin or their hair. I was focused on on certain areas, and that's fine. It was very fun, and it was very goal oriented in that sense, but it never explained why. And I could see on the women's faces this question, but why did this happen to me? Why was I diagnosed with this? And that left it so it was so unsatisfying to me. And when I asked, mentors and attendings when I was in training, they didn't have answers either. It's just often like, this is the way it is. This is how we are trained. We spent a lot of time in med school studying, but it's often just studying algorithms and what to do in what case, not understanding why. We learned everything about hormones, for example, but we didn't understand why. Why would someone develop thyroid problems? Why would PCOS develop? It just was so unsatisfying to me. So I agree with you. I think understanding the cause is really important, and bringing it together for the patient. I noticed that my female, I mean, my patients, my women and my clients, they are so happy when I bring it together for them. And together we try to figure out why something happened to them. And that really comes with getting a really good history and also asking the right questions, giving them time to think about it. It's often a process, doesn't happen from one meeting. You know, often you spend more time with a patient to get to the roots. And so I find that they can heal better once they understand why something happened, because everybody wants those answers, right? Everybody wants to know why something happens to them so they can do better and they can prevent it from happening, or they can teach somebody else to prevent it from happening. And I think that's what gives us purpose. And that's why I became a physician. I didn't become a physician just to, you know, prescribe pills or just to do surgery. I will do surgery when it's necessary, but I want to understand whether what I'm doing makes sense and whether it's really improving someone's quality of life. And I do have to admit, especially given what has happened in our world the past 3 years with health care and health policies, I'm one of the rare doctors to ask questions why we're doing things a certain way. And I don't think there's a lot of people asking those questions. I sit with my colleagues. When I was in the allopathic medicine world, I felt very lonely often. So I had to look outside of it to find answers for myself. So I think it's definitely been a more satisfying journey.
I cannot say enough how much I appreciate this approach. Like I said, that journey I took with my mother-in-law, the effort that it took to just get to where I was barely satisfied, right? And in my mind, addressing things and the doctors not meeting me there. And that was frustrating because instinctively, I think, and you can correct me if I'm wrong, if we're paying attention, we're instinctively understanding our bodies on some level. And the reason you talked about team, I think we partner with you, and I think about these things in my body and my relationships and these things, and I have to trust that when I share it with you, because it's a different way of approaching medicine, it includes all of that background, right? But it's on top of that is this truth that our bodies have, I guess is the best way I know how to express it. Yes. It's like when I was sick with Graves' disease, before it came on, I knew, and I started investigating things because the doctors kept saying, oh, you're fine, you're just under stress. And it's like, no, I knew in my body something wasn't right. And I was listing symptoms, and I started investigating. And I think that's how functional medicine was sort of introduced to me, because I began thinking outside and going, okay, why? That's a good question. Why is this happening? And being able to think about your body as an extension of, you mentioned the mind, right? Our experiences in our life. One of the things I wanted to ask you about, though, in that pile of things that you, the functional medicine and classical medicine doctor, have to deal with, is the layers of one human. And that's why I think it's unique and why I appreciate what you do, because you can't just slap an answer on it, because my body is different than my daughter's body, is different than my mom's body, because the life I've lived, the food I eat, my emotional state, my mental state. So when you talk about genetics and epigenetics, when it comes into functional medicine, how do you utilize the information around epigenetics that, you know, we have these things that are carried in through our genetics from generation to generation, and they can either be turned on or turned off, you know, how does that come into functional medicine, or does it come in at all?
Yes, absolutely. This is such a great question. And I will get to that. May I just mention something else that you just talked about earlier, when you were saying about when you go to the doctor and you know something is wrong with you. I just wanted to add something to that. I'm not saying I'm the smartest. I am not the smartest in the room. I don't know all the answers. But one thing I always offer my patients is that when they think something is wrong with them, I listen, and I'll tell them, listen, I might not have the answer for you right now, but I'll do the research and we'll go back to that, because I trust that intuition more than anything. So I just wanted to bring that. And I wanted to explain why doctors my theory of why a lot of doctors don't do it that way. It's because when we're in medical school, it's very about competition. Even to even get into medical school is very competitive. And then to make it through medical school and then residency, I remember the times I was so stressed on a human level because my basic needs for healthy nutrition and sleep and human connection were not met because I was working so much, but I had no time for those. I had to learn and study and reproduce information. And I think that creates something in people. It creates this approach to yourself that's not very loving. And you can't be loving towards other people when you're not loving towards yourself. And also the ego becomes very inflated and you feel like you have to always have answers because everything is a quiz, everything is a test. You don't make it through this training without passing those tests. And so I felt that was my answer, that maybe a lot of people don't feel comfortable saying they don't know or they don't have an answer. They would rather prescribe maybe the wrong thing or the wrong test or the wrong medication rather than saying they don't know what's going on with you. Or they would rather tell you it's in your head, it's anxiety, it's psychological than, saying they don't know what's going on. And that's the wrong use of using the mental health in that context, by the way. Often, there is actually a physical component that gets ignored. So that was something I wanted to bring up because you mentioned that. I think, and I might be wrong, that doesn't apply to everybody. There is no generalization should be made about everyone. But there's one thing that I noticed is that people don't want to admit they don't know in medicine because it's such a competitive field to begin with. And so people want to take pride that they made it so far. It's really hard to say, I've had 16 years of training, I still don't know what's wrong with you. It's really hard. And you have to get past that ego and say, hey, I have to learn more. There are so many things that when I got into functional medicine, I had no idea about. And I was like, wow, I've studied for 14 years. How can I not know those things? It's hard. You have to get past your own ego. And that I pride myself into, that I've done that work on myself. So if I have no answer, I will be honest with the patient, but I will never give up on them. And if I have to refer out or bring in the expert team, and that's what I love about Moment Health, I can ask Dr. Corneli. We have a fantastic pharmacist in our group, that Dr. Carol Peterson, who has 30 years of experience, so much more than me. So if I don't know answers, I'll bring those experts in and I will ask questions. And I think everyone should be able to do so that we can give the best care to patients. Mm-hmm. Now, to the genetic and epigenetic question, I'm so glad you brought it up. I mean, I'm sure you've heard, right? All this genetic testing is very en vogue, very fashionable. I believe that there is validity to knowing what your genetic predisposition is. I myself will not get myself tested because I don't believe there is anything severe going on. There's certain genetic mutations like the BRCA gene that can lead to cancers where I feel that if that was present in my family, I would want to know, or Huntington's disease or something very severe that would impact my life. But when it comes to the smaller mutations, the SNPs, so to speak, I'm really not interested because I'm more interested in functional markers for myself and for my patients. And I communicate that with the patient. I say, genetics is the seed, that you plant, but how the plant grows has to do with how much light it gets, which air it is exposed, what type of soil it's getting, and how you water it. But it really applies to humans as well. So I always say air, water, food, and mindset, the relationships. Those are really key components of the health. So I think those really contribute, in my opinion, a lot more to the health if we're talking about smaller mutations. But if someone comes to me and they already know what their mutations are and they want to understand more, I'm absolutely there for them and help them navigate those answers. If someone comes to me and wants to get tested, I absolutely leave it up to their autonomy to decide they want to get those tests. But what I'm saying is, in my practice, I have found that the functional translation of those mutations are much more important, and what those epigenetic factors are, as you mentioned. So that's what I try to integrate more into my practice more than anything.
It's fascinating that you talk about these genetic testing, because I feel like as humans, we want answers. Like, that's what we're going for. So I totally understand from a sympathetic standpoint. I'm hearing what you're saying about doctors, and I understand the volume of patients, especially during the past 3 years, the stress that these people were under, and from the top, right? From the top down, the expectations and the rules and the limitations, and then frustrated patients. And it was I was doing the deepest work with my mother-in-law during that season. Mm-hmm. So I understand as a logical, reasonable human, right? Yes. But they're probably experiencing, plus what I'm experiencing doesn't equal great results. But I wanted to have you on because I think it's important for people to understand that we don't have to submit ourselves to that battle, because that's what it feels like. It feels like a battle. And I am not trying to dissuade people from using a medical doctor or to say all medical doctors are bad, but I think the system is flawed and it doesn't allow for conversation, like you said. And when you find a doctor who's willing to sit and talk with you, then you find yourself waiting longer and longer to see him because he's offering that generous service to everybody, right?
Yes.
So I want to make sure that I don't come off as a doctor bashing, medical hater, but what I went through with my body and what I was trying to help correct in my mother-in-law's body and how I'm now trying to help my mom get her body in alignment. It's an interesting thing to shift as a patient. I want the answers from you, Dr. Salome. I want those answers, but I want them now because I'm used to, here's the prescription, here's the Band-Aid. But functional medicine is a process of you and I learning together because I may not be aware of my own body and my things going on. And then I have to listen to your questions and give them the time so that you know what I mean? Like it's my encouragement, I guess I'm not even asking a question. I'm just expressing from a patient standpoint, this being a functional medicine patient takes patience.
Precisely. Very nicely said. I agree. It's a process and it requires a mindset change for the patient as well, that I'm not going to have an immediate answer or easy answers. It's difficult and it's work because it requires changing your behaviors, your habits, but it also is long lasting and it really pays off. So you're right. It's not for those who want an easy fix, correct? Because I also don't believe that long-standing problems are going to be fixed with one supplement instead of a medication. If you're going to replace ibuprofen with turmeric, right, to treat joint pain, what have you really done? Okay, they're not taking ibuprofen, but they're still dependent on the turmeric or curcumin supplement. So that's not the approach either, right? So I agree. It's going to take time and it requires a change of mindset. I do not prescribe quick fixes, but I do want those who are in need, I want to immediately make them better. So there are going to be certain things that are going to be applied to help them in the immediate, but then to do long-lasting changes that takes time and we work together. And it's so wonderful when patients are on board with it. It's such a beautiful process because I learned so much from them. I have this wonderful patient who is herself in healthcare because she's a dentist, but she's been struggling with hormonal issues for years. And she had actually seen other functional medicine doctors too. And again, not everybody that is called functional medicine doctor practices the same way either. So she was there and she was given certain protocols and certain tests that they do kind of for everyone, which I don't do. I individualize. I base it on what is needed for the patient. And again, so she wasn't getting the help she wanted, even though it was functional medicine. And then she came to me and working together, we found out so many more things, so many answers that it took time to get to. Because I asked things at the beginning, but it takes time for that to translate into the patient. So slowly and surely, we got to the core of it and we found other contributors that were impacting her health. And so it takes time and it's not always a one single simple answer. I do want to go back to genetics with regards to hormones, since that's really what I'm focusing on with Moment Health and I really love it. It is absolutely true that women who have, COMT or MTHFR mutations have a harder time, for example, detoxing estrogen. And that does impact the risk for developing estrogen-dependent diseases, which can be, breast cancer, uterine cancer. And so I do take that into account. But you just still have to address how that translates for them. So when you check their nutritional status, their B vitamin status, their, and their mineral status, then you can actually see how that has translated into their markers and then specifically target. Because I have seen people that have mutations, but really we're eating so well and we're compensating for those mutations so well that they didn't need extra supplementation. But if everyone who has a certain mutation goes and takes the same supplement, brings us back to the point you said, it might not be what their specific body needs, because they might be living in a different type of environment. They might be dealing with stress better. They're getting enough exercise in healthy forms. Their nutrition is more optimized. Their light environment and the light exposure, sunlight exposure is optimized. The fresh air they're exposed to. They spend a lot of time in nature. They work on other stressors.
Mm-hmm.
They might not be as affected by the same mutation as the person next to them. So I love that you brought that up, how you are going to be different than your mother or your sister. Because often I hear, doc, yes, I have insulin resistance. I expected you to tell me because everyone in my family has diabetes.
Yeah.
Well, maybe because everybody in your family sits on the couch on Sundays and eats the same meals. That doesn't mean it's genetics. It's a lot of things are in your hand. And I like to empower women. I like to show them what they can do to optimize their health. Nothing is just written in stone, and really, really everyone can be helped, including cancer patients. It really is true. And I think that's a message of hope, and I would want to be told that there are things that I can do, And so, I just wanted to mention that as well, again, with regards to the genetics,
Yeah.
Mm-hmm.
It's an incredible symbiotic experience, because we do have stories, don't we? Like in our family, and then you can fill in the blank, right?
Mm-hmm.
In our family, everyone is big boned, everyone is stick thin. Everyone, like you said, has diabetes or whatever. Mm-hmm. And I love the emancipation from that functional medicine can give me. Mm-hmm. It allows me to be an individual in this ecosystem that I live in, right? And the ecosystem that I create. So I came from an ecosystem. Yes. And then I created my own ecosystem. Mm-hmm. And correct. I think it's fascinating. You mentioned this probably 20 minutes ago, but it's in my mind to talk to you about this idea about the body. I have a book that I've been listening to slowly because it's pretty intense. It's called The Body Keeps the Score.
Yes, it's a great book.
Oh my goodness. But it's depending on where you have been in your life, it can be a little, it's yes. a processing book. You don't listen or read that book in one sitting, from my experience.
Correct.
So I did want to have you, from a functional medicine side, talk about this idea about how the body keeps the score. I've mentioned it before in other podcasts, but in the context of functional medicine, let's talk about that idea of how the body stores traumas and emotions and how that affects our health.
Absolutely. I mean, for example, with the thyroid, I believe that can be associated with the inability to voice your opinions or your true self. For example, like just with the location or where the thyroid is, there's definitely validity to also with how in Chinese medicine we look at meridians and how things are connected. For example, that's another example. If you have a tooth infection, that can impact your breast health, or if you have root canals, things such as that. If you have a lot of pelvic pain, there's a lot of stored trauma, obviously related to sexual reproductive health. There are women that have such muscle tensity, then tense muscles, and that often has to do with not wanting, for example, to reproduce due to past trauma, sexual abuse, other types of abuses. There are women that have a lot of pain around ovulation time or ovaries, and that has again to do with how they see themselves with their fertility. The uterus also stores trauma, and if you think about it, having a cycle every month, the shedding, the letting go, you're letting go of toxins and things that you accumulated through that month. It's a healing process. So often in society, we make it as a bad thing to have a period. But in a lot of other cultures, it's regarded as a very healing time and process. Women often retrieve themselves, they get together when they're menstruating, and through pheromones, often women in communities do menstruate around the same time, and then they take time off from their partners, they use it for introspection. And it is so fascinating when you live in harmony with what your hormones are asking of your body heals so much better throughout the ebbs and flows of those natural, healing processes. So you could look at your menstrual cycle as a part of the healing process for that as well. And definitely recommend using the period or the menses as a time for introspection, gathering your thoughts, going, inwards, and not forcing yourself during that time to be extroverted, to be part of big societal, events, or be part of, or have, even schedule really, really urgent deadlines during that time, because your body and your mindset are not prepared for that. That's not the time for it. So yeah, I think bringing all that together and integrating that into the healing process of a patient, it just really makes a big difference for them as well.
Do you deal with the fascia at all, and the way that connects to our organs and all of that?
I am so fascinated by that. I watched a YouTube video of this couple that does fascial manipulation.
Is it Bendable Body?
No, but it was this couple from Nebraska. I don't know if they're able to release like fascial tension, and through that also release, for example, if the fallopian tubes are congested, help with that, or cysts. And I was so fascinated by that. I wish I could refer all patients to someone who does that kind of work. So I'm definitely open to anything. When it comes to fascia and healing, I definitely recommend fascial release and manipulation for anybody of my patients that has pelvic pain, and constipation and breathing issues, or chronic back, lower back pain or neck pain. It's just because the fascia really, through the fascia, the whole body is connected. And that impacts also in our internal organs as well, in our reproductive health. I have a patient who, talking about musculoskeletal health and manipulation like that, who started ovulating again and having periods after a chiropractic manipulation, just because her lower spine was out of line. So things like that. So when I said to you, every patient teaches me something, whenever I hear something that worked for a patient, I keep that in my lexicon of, all the treatment options. And then when I can apply it again, I'll bring those options up for the patient as well. Yes, definitely there's something to be said about fascial release and manipulation.
Yeah, there is. It's called Human Garage on Instagram.
Okay.
Go check it out, because that's going to lead you down the path to fascial release and therapy. They do some pretty interesting things. And since you're interested, and the other thing is John and Sita were on my show, and their YouTube is called Bendable Body. And of course, I want to promote this to the people who are listening too, because, I don't know if they do fascial release in that way, but the Human Garage, the guy's name is Gary. They teach fascial release to help with trauma, to help with all of the things in the body. And if I might talk to you just briefly about this concept, I've noticed my hips over the last few years, and certain things are happening with my mom or my mother-in-law. My hips flare and trigger. It's really interesting. I used to have a trigger in my gut that was a witnessing abuse from my childhood. But once I finally broke through that, then it moved up into, when I get triggered, it kind of aches in my chest. So what I'm trying to say is my own body and I have been in a conversation for a long time. And I've understood that the hips, which is obviously the seat of a woman's, reproductive area, right? That's the support of our birthing area. I guess I don't know what words to use there, but I've noticed that hips, and I've recently heard that hips are a very common area for the body to store emotional stress.
Okay.
And so I think when we talk about functional medicine, this is all part of the conversation, which can feel very uncomfortable for people. But I wanted to have you on so that we could open people's eyes to the fact that this universe that we live in, our own body, is like a universe. It's miraculous. You mentioned earlier the plant idea, that the soil, the water, the light, the quality of the seed, the quality of the food, it all matters. Like if I take a houseplant, for example, that's perfectly healthy, it's in the best soil with the best fertilizer and the best purified water, but I set it in the wrong place and it doesn't get the light that it needs.
Yes.
It will suffer, right?
Yeah. Correct.
But I might have a plant in the right place with kind of mediocre food, mediocre water, but it might thrive. So I think if we could, it's oversimplification, I'm sure, Dr. Salome, but I'm trying to help put a word picture to our bodies. It's like all of these things matter, and we might be okay living this way. But I think functional medicine is seeking that optimal version of health and life. Am I right?
You are absolutely right. I want women to be beyond okay. I want them to thrive and figure out what that environment means, what it is for them within the context of their reality, right? I might want to spend 4 hours grounding and reducing my body voltage away from EMF in the sunlight in the beach of Florida every day. I cannot because I have to work. So it's within the reality, and then if you have kids and you have a job and you have a husband, I often, I look when my patients, when I suggest some dietary changes, when I look at their face and I see how overwhelmed they are, I often, take a step back and say, listen, this is a stepwise process, and I only expect you to do how much you can do. And then we come up with some maybe better ideas of like, how can we meal prep? You don't have to cook every day or things like that. But yes, how can I make women thrive within the reality of their environment and the context of their reality? And it's an individualized approach, and it requires conversations and getting to know each other, and them obviously trusting in me and opening up to me. So yeah. By the way, to the fascial work, I just wanted to add also, you said trauma. Surgery is a trauma. I pride myself in the technical skills I had to acquire over 6 years to become a surgeon, and still continue to learn as I'm in the operating room. But it causes trauma. A C-section causes trauma, and that fascial pain can lead to multiple problems later on too. And so I will definitely check out the Instagram you suggested and the couple, and continue to learn, because I do think that I just wish I had this network of the best of everything that I could just take with me everywhere, because, we do this through Moment Health, we do virtual health, right? So I'm available to patients all across the country, but I don't always have the best acupuncturist, fascial release, manipulation, person, physical therapist or psychotherapist available to me, or nutritionist. I wish I had a team every single place in the country that I could refer people to always get the best care. So since that's not always available, I love that there are people out there that teach people how to do it on themselves as well, and try to heal part of the healing process to do it themselves, because we don't always have access to the best of the best, So, but I love that, all it needs is just a little bit of information and spreading the knowledge, and then having patients find out on their own also how they can, obtain the best care.
It really requires a level of openness, right? Because it is a different way of approaching it. And sometimes things come up. Let's say we're talking about this fascial release. It makes people uncomfortable.
Yes.
Because it's outside of the known, or outside of the norm. I'm using air quotes but I believe that healing is on the other side of a lot of what we accept and know. Like there's so much more to what we could be doing. And I want to thank you for being willing to have this conversation with me, because I think it really comes down to, you mentioned it, me, if I'm your patient, I'm trusting you, and I'm willing to allow you in to my internal world so that you can help me. And I think just that if somebody's in a situation where they're feeling they know something's wrong, or they've been in medical care and all it's doing is re-traumatizing their body, or they can't get healthy, I would love to encourage people, this is just my own little ad here, that to open yourself up to the miracle that our body is, and that there is a way to navigate our health that is more proactive. We can partner in it. We have to get out of the whole like receiving seat, right? Like, okay, I'm just going to go in, get my answer and leave. I believe if someone's really in a chronic situation, that they can use functional medicine, but they have to suspend disbelief, right?
Yeah, correct.
The
And
shift.
they have to get past previous negative experiences. It's just like with a relationship. If you want your relationship to succeed with your physician, gonna have to allow them to gain your trust too. You might have been traumatized by many physicians not listening or suggesting the right treatments, but that doesn't mean that the next one is going to make the same mistakes for you. So yes, there's going to be an openness that's required, and it's a learning process for everyone. It's a learning process for me to keep understanding patients better, especially the hurt ones, the ones that are more difficult to get to, the ones that express their pain in different ways. They use different words. They might even sound hurtful towards you as their, caretaker, but it's often, there's always some sort of trauma behind that and some mistrust, and you can move past that. And if you can, then miracles can happen. I think that's where the magic comes in, and that's where we come in as humans. I mean, I keep reading about how AI is going to be used to replace doctors, and I think it might not make a lot of difference for people who just follow algorithms, but it will make a ton of difference for physicians that really care and listen and that individualize their approach. And so that's why I wanted to change my path as quickly as possible, because I see where the future is going and what's needed. And I really hope many young doctors coming out of training also realize how important it is to look outside of the box and learn more beyond allopathic medicine, as many open-minded physicians as possible, so that we can all have our grand rounds and discussions and conferences that educates us each other, so and the patients will benefit. The more open conversation there is, the less censorship of medical opinion, the better it is for everybody.
You said one important word, it's relationship, and it was there in front of me, but when you said it, it's like, yeah, that's what it is. We use the term, but in a traditional sense, it's not really a relationship. I don't have enough time to get the answers that I want, and I feel like I have to fight for it, right? Yeah. This functional medicine doctor to patient is an intimate relationship, because I have to trust and partner with. So I love that beautiful picture. Now, if you were to give 3 kind of key takeaways or things that you want people to really anchor in on, what would those be, Dr. Salome?
I would say trust your instincts. Trust your body. If something doesn't feel right, do not give up to look for answers until you find the right doctor. And that brings me to the second thing, that would be, find the right physician. If you meet with someone and it doesn't feel right, keep looking. I often tell patients, don't just trust what I say, go and get a second opinion, get a third opinion. I might learn from another person's opinion on your case. So I think you really have to move past your ego as a physician. And as a patient, you have to move past that fear that you might disappoint your physician if you're going to get a second opinion. And then the third thing would be self-love and self-care, for women. I think in order to heal, you have to really love yourself and believe that you deserve to be healthy and heal, and to really take the time for self-care. Because if you don't make the time now, when you're still relatively healthy, then really bad disease will happen. And then you will have to make time for the disease. And so really make time for your health now, and find someone that wants to help you optimize your health now, your wellness and well-being, while you're still relatively healthy, to prevent from really, really bad things happening that are much harder to treat, where you then have to chase your tail and trying to catch up. So I would say those would be the key takeaways that I would, want to share with women.
Mm-hmm. Wonderful. Yeah. Now, Dr. Salome, how do people find you?
So with Moment Health, we have a website, momenthealth.co. And there is, all the pricing, the services we offer, and our schedule. There's also those home home kits for hormone testing that women can order. And then they set up a consultation and they get to see me. Yeah.
Mm-hmm.
Wonderful. Very easy. Very streamlined.
Well, I've actually been through the process. And so there will be a link to connect with Moment Health so that you can check this out for yourself. And of course, we want more women to know about this option. It's such a, I want to thank you so much for sharing this, because it's gentle, it's holistic, it's intuitive. It is, in essence, it feels like a very feminine process. The functional medicine just feels like something like a mother would do, and I appreciate you reaching out and asking me to spend time with you to learn more about your perspective on functional medicine and your perspective on true health, what health really means, what healing really means. And I'm so appreciative of the time that you spent and for the clarity that you expressed it, so that other women and men can get information about the ability to take control of their own health. I'm just so grateful for people like you who are willing to do the hard work. And like you said, navigate a completely different person every single time. You're entering a different universe every time you meet a new person. And
it's so exciting. I love that process.
But I'm grateful for doctors like you, because it brings hope to someone like me who wants that doctor who's willing to partner with me. So thank you so much on behalf of anybody who partners with you for helping bring true healing and health into the world.
Thank you so much. Thank you for having me. Thank you for allowing me to speak here. And yes, it was lovely. And I really hope that I was able to reach out to a few women to help them realize how important it is to take care of themselves. So yes, Thank you so much.
It's my pleasure. Friends, today I've been speaking with Dr. Salome Masghati. She is a board certified gynecologist. She is with Moment Health Co. And if you head on over to www.feminineroadmap.com/episode 318, you will find links to her and Moment Health Co. there. If you are on YouTube, just look down below. I will have all the links there for you. Friends, the reason that we had this conversation today about functional medicine is because I've personally been through a journey of an autoimmune disease that really took me down and out for 3 months of my life. And it was hard to come back from. And I wanted answers and couldn't find them. And I can look back now and see how helpful it would have been to have this information, to have the choice to go toward my health in a different way. I'm passionate about helping women live healthy in their mind, their body, and their soul. And so functional medicine, I believe, is one of those tools you should have in your tool belt at all times to help you, your daughters, and your friends find the answers that they need when you're not finding them in the traditional route. Personally, my opinion, not a doctor, just me, I say head to the functional doctor route. Give that a shot. Find out what it is to know your body better, to have a doctor who's willing to do that journey with you and find the true definition of health in a way that feels authentic and aligned for you. So thank you so much for being with us today, friends. I look forward to sharing more inspirational conversations, tips, strategies, and people with you in the weeks to come. Take care, my friends. Bye-bye.